Next, we have Dr. Izadem FIDHA RAFEE. She'll be talking on visual outcome in patients at first 1 year post blunt trauma treated at a tertiary care center.
Good morning, everyone. My topic for paper presentation is visual outcome in patients at 1 year post-ocular blunt trauma treated at a tertiary care center. Aim of study is to determine the visual outcomes in patients who sustain blunt trauma and to compare visual outcome with predicted visual outcome according to the ocular trauma score study. Materials and methods: study design, prospective cohort study. Study duration is of 1 year. Sample size 32. Study population: all male and female patients coming to Department of Ophthalmology having sustained ocular blunt trauma treated and followed up here itself. Inclusion criteria: patients of all ages, both males and females. Exclusion criteria: those with previous ocular disease, those with head injury, severe chest and abdominal trauma, those not able to come for follow-up, and unconscious patients. Study variables: demographic characteristics, place of injury, and OTS score, that is score of 1 for 0 to 44, 2 is for 45 to 65, OTS score 3 is for 66 to 80, and 4 81 to 91, and OTS score 5, that is 92 to 100. Results: this prospective cohort study was done in a tertiary care center. 32 patients fulfilling the inclusion criteria were included in our study. There were total of 32 patients. Among that, 20 were males and 12 were females. The age of presentation was less than 10 in 5, 11 to 20 in 8, 21 to 30 in 5, 31 to 40 in 4, 41 to 50 in 6 patients, and more than 50 in 4 patients. Regarding the occupation, 12 were students, 7 were professionals, 2 were skilled worker, 1 unskilled worker, 2 manual laborers, and 8 household workers. Place of injury: out of 32 patients, 3 sustained injury from workplace, 13 from home, 4 from school, 1 from road, and 11 patients sustained injury from other areas. Zone of injury: about 17 patients had injury to cornea and limbus, 14 patients to cornea, limbus, anterior segment and posterior segment, and only one of the patient had injury only to the posterior segment. Initial best corrected visual acuity, that is at the time of presentation, about 15 patients had initial BCVA of 6 by 6 to 6 by 12, 13 patients 6 by 18 to 6 by 36, 3 patients had 6 by 62, counting fingers close to face, and one of the patient had BCVA of range, hand movements to perception of light. Then ocular trauma score. Ocular trauma score, about 17 patients had trauma score of 5, that is 92 to 100. 14 patients had ocular trauma score of 4, that is 81 to 91. And one of the patient of my study only had 45 to 65, that is OTS score of 2. BCVA at 6 months for OTS. As the OTS score is high, the probability of having better BCVA at 6 months follow-up is higher. And from my study, I could found that 28 of the patients had 6 by 6 to 6 by 12 at 6 months, and 4 of the patients had 6 by 18 to 6 by 36 at 6 months. And 78% had edema, ecchymosis of lids and adnexa. 25% had chemosis and congestion, 65.5% had Descemet's membrane folds, 18.8% had sphincter tear, 25 patients had AC hyphema, 1 patient had subluxated or dislocated lens and phacodonosis, vitreous hemorrhage in 10 patients, and IOP was more than 21 in 14 patients, commercial retinal seen in 13 patients, retinal hole and hemorrhage in 2 patients, no retinal detachment noted in my study. Treatment: 28 received topical drugs like antibiotics, anti-glaucoma medication, cycloplegics, and steroids. 2 of each received medical surgical treatment like AC paracentesis, usage of bandage, contact lens, and others. And 2 also received medical BCL and barrage laser. BCVA at 1 year of trauma. About 30 patients had BCVA at 1 year of 6 by 6 to 6 by 12, and 2 patients had 6 by 18 to 6 by 36. Discussion: higher incidence of ocular trauma was noticed in male workers in this study, which was similar to study by Nirmala P. et al. Patel et al. Also found ocular injuries were more common in males. The majority of patients, that is about 25%, were between the ages of 11 and 20 years, which was similar to my finding. From our study, it was also found that if the OTS score is high, the probability of having better visual acuity at final follow-up is higher. Similarly, as the OTS score is high, the probability of having better BCVA at 6 months follow-up is also higher. And RAFEE et al. Also found that high OTS score is associated with good visual prognosis, which was similar to our findings. Conclusions, as already said, BCVA at presentation was about 6/6 to 6/12, which was seen in 15 patients, and 6/18 to 6/36 in 13 patients, and 6/62 counting fingers close to face only seen in 3 of the patients, and hand movements to perception of light seen in only 1 patient. And when we followed up, we got the BCVA at 1 year as 6/6 to 6/12 in 30 patients, 6/18 to 6/36 in 2 patients. And OTS score was also 17 patients had OTS score of 5, 14 patients had OTS score of 4, and only 1 patient had OTS score of 2. So overall, this study reinforces the value of the OTS in predicting visual prognosis and improving the management of blunt ocular trauma, ultimately contributing to better patient outcomes and more effective use of healthcare resources. Thank you.
How did you calculate this OTS score?
Sir, actually this OTS score has got certain variables like initial visual acuity, globe rupture, perforating injury, retinal detachment, and RAPD. And my patients were only confined to blunt ocular trauma patients. So my main study variable was visual acuity, initial visual acuity.
This score was given during injury or after 6 months?
No, at the time of injury.
At the time of injury.
Yeah, and this score helps us to know the visual prognosis, and if higher the OTS score, then the prognosis will be good, and we can get it on
You
BCV
have
at
given
6
now
months.
DM fold, decimal moment folds.
Yeah.
What was the IOP in those patients?
Sorry?
What was the IOP, intraocular pressure, in those patients?
Actually, IOP was found to be more than 21 in 4 of my
You
patients.
told DM folds.
Yes.
About some patients, 11 patients or something you told. In them, what was IOP?
Not everyone had more than 21.
See, decimal folds can occur only when there is a low IOP. Please remember.
Only 4 patients had IOP more than 21 in my study, out of 32 patients.
And we expect decimal tear to occur in a case of raised intraocular pressure. That's normally.
So you had household injuries more, no?
Yes, sir.
What was the type of injuries?
Household injury mainly seen in female patients from trauma by hitting by the child, like that.
Okay.